गुड इवनिंग ऑल, आप सबको मेरा प्रणाम। मैनेका दत्ता, Srinivas. So today we are starting Farre number 6. So that is basically Thanatology. So as you know, Thanatology means study of death in detail. Thanatos is the Greek god of death. One very important topic in forensic medicine. So comes under forensic pathology. Okay, yes, Maneka Datta. And Sinch, good evening, Sinch. Priyanka, Smaranya Hati, Vasista Sai, Tahir Naik. Okay. Yes, thank you. Thank you all. So shall we start? Shall we start, guys? Okay. So one important question. So बहुत ही important है. Rigor mortis. So rigor mortis is very commonly asked main question. Rigor mortis, Livor mortis, Algor mortis, Putrefaction, Mummification, Adipocere formation, embalming, exhumation. So around 20 mark to come from this thanatology. And very important Viva question and very commonly asked in INI-CET, NEET PG and other entrance exams. Okay, so let's start. This is one very commonly asked main question. So bar पूछते. So the question is, classify post-mortem changes, explain mechanism, order, causes of early onset, late onset and medico-legal importance of rigor mortis. So to begin with, so all of you guys, so rigor mortis is what type of post-mortem change? Is it early change or late change or is it immediate change? Okay. So rigor mortis in general, it is early post-mortem change. So that starts after 1 to 2 hours, that persists for about 36 hours and it merges with the putrefaction, it disappears. It's an early post-mortem change. Let's see one by one. So what are post-mortem changes? See, post means after death, ante-mortem means before death. So classification of post-mortem changes, immediate changes. So one is immediate changes, that means that occurs immediately after death. So they are basically irreversible cessation of function of brain, respiration and circulation. There are some changes in the muzzle, there are some changes in the pupil. Early changes within 24 hours, rigor mortis and others. Late changes, decomposition, that we call it as putrefaction, adipocere formation, mummification and skeletonization. Okay, yes, you know, one by one. So Smaranya, you can ask me doubt at the end of the session. So immediate changes, irreversible cessation of function of brain. So especially when there is a damage to the RAS, reticular activating system. So that leads to loss of consciousness. So that leads to irreversible cessation of the brain function. Okay, RAS. Then respiration. So in case of death, there's a damage to the higher centers of the respiration, as you know, apneustic center and medullary centers of respiration. So when there is a hypoxia, so there is a damage to the higher center, there is cessation of respiration as well. So these three basically system, they are known as gateways of death. Again, very important funda, very commonly asked in the exam. What do you mean by gateways of death? So gateways means, so either it can be respiration, CNS function, or it is circulation. It is known as Atria Mortis. So all of you write in the chat box, Atria Mortis is equal to gateways of death. That means the gate through which the hemorrhage, or we call it as Thanatos, enters the body and causes the death basically. Gateways of death. Okay, keep writing this, keep writing all of you guys, Pranav and others. Yeah. Then there is one important muscle change in case of death that is basically known as immediate change, that is basically primary flaccidity. Primary flaccidity, that means primary relaxation of muscle. So all the muscle, so they undergo relaxation by utilizing the ATP that is there in the plasma. So the change that occurs in the muscle, that comes under immediate change, that is primary flaccidity, not the rigor mortis. So try to understand this. So rigor mortis comes after the primary flaccidity. Okay, yes, good. Then comes his pupil. So pupil usually dilated. And remember, the pupil is constricted in case of onset of rigor mortis. So this can be asked in your exam. Normally after death, the pupil is dilated, but pupil can be constricted due to onset of rigor mortis, that is usually after 2 to 3 hours. So this is also asked in your exam. Okay, dilated pupil. Then early changes. What are early changes? So there are basically 3 important changes. So one important change is rigor mortis. So rigor mortis means shortening and stiffening of the muscle and joint. Then livor mortis. That is known as post-mortem staining. The blood collects in the dependent area. So that is also known as darkening of death, livor mortis. Then comes is Algor mortis. Algor mortis means post-mortem cooling. So the cooling of the dead body, the cooling of the body occurs after death. So because of the loss of heat by evaporation, convection and all, conduction as well. Okay, yes, so these 3 are basically important changes, that is they are known as early changes. Then late changes. So late changes, we call it as putrefaction. We can see here putrefaction, Adipocere formation, then mummification and skeletonization. And also here some more changes here, eye changes and some changes in the skin also, skin changes. So there are basically 5 important changes after death, that is usually within 24 hours. They are known as early change. Okay, good, that's great, all answering, all are interacting, that's great. What are eye changes? Can anyone answer? What are eye changes? Eye changes can be 3 marks question. 3 marks question. What are eye changes after death? At least 4 you need to write in the exam. Come on, one by one. So Arlin is telling, sir, Tache or sclerotica. Very good. Tache, Noire, sclerotica. So that is a triangular patch. So that is normally occurs in the sclera in 3 to 4 hours because of the dryness, because of the desiccation of tissues. Very important. बार बार पूछते हैं लोग, ठीक है, ठीक है. Then second important change. So there is an increase in potassium level in vitreous. Okay. Then as you know, the pupil is dilated. So pupil can be constricted in rigor mortis. IOP becomes zero. And in the retinal vessels, you will see Kevorkian sign. Kevorkian sign. So very important. What is Kevorkian sign? So Kevorkian sign is fragmentation of blood in the retinal vessels. For example, this is retina. So this is retina. So this is the change. Okay. So the fragmentation of blood or the blood column that occur in all the blood vessel, but that is clearly visible in retina, that is known as Kevorkian sign, that occurs within 10 minutes after death. It persists for about 1 hour, which is detected by Dr. Kevorkian. Dr. Kevorkian is a very famous doctor who is well known for euthanasia. So Dr. Kevorkian is a euthanasia doctor, or Dr. Death we call it as. Okay. So you can write in the chat box. So Dr. Kevorkian is equal to okay, Dr. Death. Dr. Death. So very interesting funda. You can write Dr. Kevorkian is equal to Dr. Death. So Dr. Kevorkian was arrested, so under the charges of culpable homicide and murder, because he was helping many patients, especially the patients suffering from depression, to commit suicide and to cause painless death. So that's why the word Dr. Kevorkian, Dr. Death. Just keep writing this. Okay, this is fine. Then yes, so then again one more question commonly asked: what is thanatology? So thanatology is a study of death in detail. Thanatos is the Greek god of death. Okay, Thanatos. You can write this also in chat box. Thanatos is equal to Greek god. Like we have Yamaraj, Yamaraj Hindu god of death, or Hindu god of death, like Shiva and Yamaraj. So in Greek it is Thanatos, not Thanos, Thanatos. Okay, so again this is very important question. So this is very important 5 marks question as well. You can write this. This is more than sufficient. Okay. And some more points here, especially in late changes. Late changes that occur after 24 hours. It is because of the proteolytic enzymes produced by Clostridium welchii. So the color of dead body commonly asked. So color of dead body in putrefaction. So putrefaction, what is the color? Commonly asked. Mummification, what is the color? And Adipocere. Adipocere. So very important question. So putrefaction, the color is green. The pigment color is green. Why green? Because of sulf methemoglobin. because of Clostridium welchi. Mummification, the color will be black, and Adipocere, it is usually white. So this is again commonly asked. So mummification occurs in hot, dry environment. Adipocere occurs in warm, humid environment. The most common postmortem change among the late is putrefaction, and putrefaction is very foul smelling. Very foul smelling. Commonly asked in the exam. Okay. So I'll repeat again. So classification of postmortem changes: immediate, early and late. Immediate, basically gateways of death, muscle changes and pupil changes. Early, there are 5 changes: rigor mortis, livor mortis, algor mortis, eye changes, skin changes. Late changes, basically adipocere, mummification and putrefaction. So eye changes, basically there are 4 changes. One is Noire sclerotica. Second one is increase in potassium level in the vitreous. Third, IOP becomes 0. Pupil is dilated. There can be corneal opacity. So then Kevorkian sign. Kevorkian sign is basically fragmentation of blood in the retinal vessels. So Dr. Kevorkian, Dr. Death. Thanatos is the Greek god of death. So color of dead body in putrefaction, green color. Mummification, black color. And in case of the adipocere, it is white color. It occurs in warm, humid environment. Is it clear, guys? Is it clear? Srinivas? Srinivas and others? Very important question, commonly asked. So just say yes or no. So this is how you should write in your exam. Smaranya, are you there? Smaranya? Okay. Smaranya, to get distinction, so you have to write like this. So if you write all these things in a 5 marks question, so what is your expectation? So 5 marks question, classification of postmortem changes. If you mention all these points along with these extra points, then what is probably the marks you are going to get? Srinivas is telling sir 4. 4 to आराम से मिलेगा. आराम से 4. Good. Smaranya 4. So Dr. Sinch is telling sir 5. So ठीक है, good. That's great. 4.5. Vasishtha is telling 4.5. That's also fine. Now look at this. Now it is your turn. You need to identify what is this. What is this? Okay. What is this basically? A dead body after 3 to 4 hours. What we can see here, triangular patch. So in triangular patch, so the base is towards the limbus. Okay. So what is this known as? Yes, so this is basically known as Noire sclerotica. So all of you write in the chat box, TNS is equal to 3 to 4 hours. Like this. TNS is equal to 3 to 4 hours. Good. Keep writing. Then we have one more case here. One more case. So look at this. So there is a finding here. There is a finding. Right iliac fossa. So what we can see here, greenish discoloration. So this greenish discoloration is first external finding in case of putrefaction. Commonly asked, what is the first external finding in case of putrefaction? Your answer must be greenish discoloration at the ileocecal junction or the right iliac fossa, where there is a growth of Clostridium welchi. So Clostridium welchi is a gas gangrene forming bacteria which produces greenish pigment. So it starts, so within 6 to 10 hours it starts. So then the classical change usually occur after 24 hours. Okay, right iliac fossa. That's great. Next comes is the rigor mortis. Rigor. Very important. Very important question. Let's see what to write in rigor mortis question. So, what is rigor mortis? Rigor mortis is early postmortem change. I said early means within 24 hours. Postmortem, remember it occurs after death. It occurs after death, not before death. So early, less than 24 hours. It occurs after death. After death. So point number 2, very important. Characterized by shortening and stiffening. Usually shortening and stiffening. In general, basically stiffening, not the shortening. Stiffening of the muscle and joint. Of the muscles. So muscles means all the muscles. So all the voluntary muscle and involuntary muscle. Voluntary plus involuntary. Rigor mortis occurs in all the muscles. Voluntary muscle, involuntary muscle, smooth muscle, skeletal muscles, all the muscles. But the cadaveric spasm that occur in only voluntary muscle. So please write in the chat box. Cadaveric spasm occurs in voluntary muscle. Voluntary muscle. So write this in chat box. Very important funda. Now say example here, a dead body like this, okay, dead body like this. So is it rigor mortis or cadaveric spasm? Come on guys, like this, okay, or some hammer like this, like this. So is it basically cadaveric spasm or it is rigor mortis? Yes, good. That's great. So that's great. Great. So in my experience, one case actually, one cricket player who died due to electrocution. So as you know, electrocution, death is sudden because of the ventricular fibrillation. So in that case, in my experience, so he was holding back like this, okay, some wet bat with the moisture, he was holding like this and he died because he was touching the current wire, so which was passing through the wet bat and to the body and died like this. He was like this. So my question, is it rigor mortis or is it basically cadaveric spasm? Come on guys, come on. Yes, come on guys, can answer. Try. So it's basically cadaveric spasm. Good. So cadaveric spasm is always occurs in voluntary muscle. So it is usually antemortem. It shows the manner of death. Very important funda. So that's great. Okay. So after death follows the period of primary flaccidity. So all the muscle undergo primary flaccidity, then they undergo rigor mortis, then secondary flaccidity. So basically muscle changes are, so muscle changes how it occur in dead body. So then they undergo primary relaxation, PR, primary relaxation by utilizing ATP in the plasma. Then all the muscle undergo rigor mortis, RM. Then they undergo secondary relaxation, or we call it as secondary flaccidity. So this is very important funda. So all of you write in the chat box. Muscle is equal to PR, RM, SR. PR, RM, SR. Write this in chat box. So very important. Okay, so this is about the definition. So I hope you understood rigor mortis, early postmortem change, and all this. Okay, mechanism. Why do the rigor mortis occurs in dead body? So because of basically ATP depletion. ATP depletion. Okay. So when there is no ATP, there is no separation of actin and myosin. So as you know what happens, so muscle contraction occurs. So that is because of the filament actin and myosin. When there is no ATP, there is no separation of actin and myosin filament. So that leads to stiffening of the muscle. So basically ATP depletion, and in case of rigor mortis, there will be increased lactic acid level. Increased lactic acid level. That's why it is known as acid rigor. Rigor mortis also known as acid rigor. Cadaveric spasm is also known as alkaline rigor. Acid rigor मतलब rigor mortis होगा, alkaline rigor मतलब क्या होगा, cadaveric spasm होगा. तो याद रखना पड़ेगा. Okay, that's great. Then good. Then order. So it starts with the the muscles of the heart. So it starts with the heart, then it starts with the small muscles of the eyelid, face, neck, then the chest, the trunk, the upper limb, lower limb, and the small muscles of the hand. So that rule is known as Nysten rule. Nysten rule. So this is very, very important. The order of appearance of rigor mortis. Let's say what is that. So this is Nysten law. You need to write in the exam. The heart, that is around 1 hour. Rigor mortis in heart resemble like left ventricular hypertrophy, LVH. Eyelids 3 to 4 hours. Then comes his neck and lower jaw. The face around 4 to 5 hours. Chest 5 to 7 hours. Upper limb 7 to 9. Then abdomen, then uterus, then lower limb, fingers and toes around 11 to 12 hours. It disappears in the same order. So this is known as Nysten law of appearance of rigor mortis. Very, very important. The first voluntary muscle, eyelid muscle. The first involuntary muscle, that is heart, left side of heart. Left side of heart. Very, very important. Chal, theek hai. Then we have one more rule, that is known as rule of 12. Rule of 12. So what is rule of 12 in rigor mortis? That is, rigor mortis appears in 12 hours. So it starts within 3 to 4 hours. It appears completely within 12 hours. Rigor mortis maintained for 12 hours. Maintained for 12 hours. And it persists for 12 hours. So this is known as rule of 12. Commonly asked 3 marks question, rule of 12. So there are many rules, like rule of 9 in bone injury. So rule of 12 in case of rigor mortis. Okay? Chalo. Then we have some more rule known as Shapiro rule. Shapiro rule. So this you can write. If you write this word Shapiro rule, you will get distinction mark. Shapiro rule means the rule of proximo-distal progression. So it's a rule of proximo-distal progression. That means it involves the proximal muscle, then involves the distal muscle. Matlab, so in the beginning it involves the biceps muscle, a triceps muscle, then involves the forearm muscle, then last it involves the small muscles of the hands. Proximo-distal progression. So try to understand this. This is very important. Good. Commonly asked. Okay, now I have a question for you. Does rigor mortis occur in poliolimb? Does rigor mortis occur in poliolimb? Say yes or no. Say example, dead body of polio affected person. Since both the lower limbs are paralyzed. My question, does it occur in polio limb? Yes or no? The answer is yes. So the answer is yes. I said rigor mortis occurs because of ATP depletion. It is not because of the nerve supply. It is not because of the blood supply. It occurs because of the ATP depletion. So ATP depletion can occur in any muscle, atrophied muscle, paralyzed muscle, any muscle. So it can occur. So it occurs. Then one more question. Rigor mortis not seen in. So rigor mortis not seen in fetus less than 12 months, fetus less than 7 months. This is again important prof question. Rigor mortis is not seen in fetus of age less than 7 months. So the proper muscle development, the actin, myosin and all, that occurs after the age of viability. So for that reason, the rigor mortis is not seen in fetus less than 7 months. So that is also important. Okay? Yeah. Good. Now question comes is, okay. Yes. Chal. So order you need to write like this. Then comes a differential diagnosis. So differential diagnosis, I'll write here DD. DD. Not Duradarshan. Differential diagnosis are conditions simulating rigor mortis. So what are they? So the one is cadaveric spasm. Cadaveric spasm. So remember, cadaveric spasm is always antemortem. Always antemortem. And the pH is alkaline. It shows the manner of death. It occurs in voluntary muscle, not the involuntary muscle. One differential diagnosis. Second, heat stiffening. Heat stiffening. The heat stiffening occurs in case of burn injury, antemortem or postmortem burn injury. So because of the denaturation of the protein or coagulation of the protein, we call it as boxing attitude. I think we discussed in previous classes. Boxing attitude. Again, it can be antemortem or postmortem. So this is always antemortem. So this can be antemortem or postmortem. Then we have one more known as cold stiffening. So because of the extreme cold, when body exposed to extreme cold, especially in freezer compartment. In forensic medicine, no, we keep dead bodies in freezer compartment. So in freezer compartment, normal temperature is 0 degree or less than 0 degree. So at that temperature, what happens? There can be freezing of the muscle. So all this freezing of the muscle resemble like stiffening of the muscle. So that is a differential diagnosis. Then comes this gas stiffening. Gas stiffening. So gas stiffening because of the putrefaction. As you know, in putrefaction there is a production of gas. So because of the gas there can be stiffening like appearance. So there are basically 4 conditions resemble like rigor mortis. Very, very important 3 marks question. Then comes its medico-legal importance. Can anyone answer? What is the medico-legal importance of rigor mortis? What is the medico-legal importance of rigor mortis? Come on guys. Medico-legal importance of rigor mortis. MLI क्या होती है? Rigor mortis basically, है ना? So one is time since death. Very good. So it helps in estimation of time since death. Good. So with the help of rule of 12, great. Then posture. So it can tell you about the position of dead body. Position of dead body. Good. Good. Okay, rigor mortis can be delayed in some poison. That's also good answer. And one more thing, it is a sign of death. It's a sign of death. And it is delayed in some conditions, and it occurs rapidly in some condition. We call it as late onset and early onset. So yes, so all these are basically medico-legal importance. So let's see now. So I'll repeat again all of you guys for 5 marks question. So rigor mortis, you need to write about the definition. Proper definition from K.S. and Reddy. Early postmortem change, all this you need to write. Mechanism, ATP depletion and lactic acid. Order, Nysten rule, Sheffer rule of 12. Differential diagnosis, there are basically 4. Then you can also write about the medico-legal importance. So 1 or 3 or 4 medico-legal importance. Is it okay guys? Have you understood? Srinivas and others? Kushal Patil, how are you Kushal Patil? Kushal Patil? Yes. Great. So now comes is very important table from Rajesh Bardale textbook. Early onset passes of early, delayed onset, rapid onset but stays longer. So 3 important important points. Early onset occurs in electrocution like this electrocution. Then cancers, convulsions, hyperpyrexia, metabolic acidosis, uremia, heart environment conditions. In all these conditions, early onset. So what happens in electrocution and all? So in electrocution, there will be violent contractions of the muscles, like this now violent contraction of the muscle. So there will be ATP depletion. So there is a rapid ATP depletion that leads to early onset rigor mortis. Delayed onset occurs in asphyxia. As you know, asphyxia is a painless death. So that's why delayed onset. Apoplexy, cold environment, hypothermia and all. So rapid onset that occurs in case of strychnine and hydrocyanic acid, but it stays longer. So why? Because this strychnine is a poison. Cyanide is also poison that inhibits the growth of Clostridium welchi. So this is one very, very important table. Okay, any doubt in this? Smaranya, any doubt? Manikarnika, Aishwarya, Baligar, Manika Datta, Srinivas and others. So if you have any doubt, you can ask me. No doubt. No. Chalo, ठीक है. Now you need to identify what is this condition. What is this condition? Taken from standard textbook. So this is basically known as cadaveric spasm. Cadaveric spasm. So we need to write some few points about cadaveric spasm. So cadaveric spasm is ante-mortem. Point number 1. It occurs in voluntary muscle. Okay. So we are talking about cadaveric spasm. So cadaveric spasm is always antemortem and it occurs in the voluntary muscle. It shows manner of death. So what it shows? It shows manner of death. And the pH is alkaline. So the exact pathology is unknown. So the exact pathology, so that is basically unknown in case of cadaveric spasm. Now okay guys? Yeah. Then look at this change. Can I identify this change? So what about this? So which occur in case of bone injury like antemortem or postmortem bone. There is a denaturation of protein like a boxing attitude. So what is this known as? So this is known as heat stiffening. So the heat stiffening occurs in temperature more than 70 degrees Celsius. So it can be antemortem, it can be postmortem. Usually it is a postmortem artifact. Then comes is one more important change. So that occurs in extreme cold environment. When muscles are exposed to some cold environment, so there can be denaturation of the protein again, and what we call it as cold stiffening. So what is this? Cold stiffening. And one more change, that is the differential diagnosis of rigor mortis. So this is basically known as gas stiffening. Gas stiffening. So this finding is basically marbling. Marbling. That's great. Okay. So what you can see here, tree-like pattern. So over the upper limb and the chest, which is normally seen after 24 hours, so up to 48 hours, because of the self-methemoglobin produced by the Clostridium welchii. So this is about the rigor mortis. Is it clear, guys? Is it clear? Okay, Srinivas, okay, fine. The next important question is usually a 3 marks question, or it can be a 5 marks question. Differences between rigor mortis and cadaveric spasm. So already we discussed in the previous slide. So this is rigor mortis and this is basically cadaveric spasm. So this is a case of drowning, so with the hand with the aquatic matter. So we call it as cataleptic rigidity, a cadaveric spasm, which is antemortem drowning basically. So in exam you need to write this table. So differences between cadaveric spasm and rigor mortis. Time of onset, 1 to 2 hours. Here it is immediate. So this is important point. Mechanism. So it is due to depletion of ATP. Here it is unknown. Muscles, all the muscles like voluntary muscle, involuntary muscle, all the muscles are involved in rigor mortis. So only some group of muscle, especially muscles of the hand and the forearm in case of cadaveric spasm. Muscle stiffening, that is moderate, but it is very strong in case of cadaveric spasm. Predisposing factor, none, but here it can be sudden death, excitement, fear, emotional disturbances and all. Molecular death occurs here, but here there is no molecular death. So try to understand this. In cadaveric spasm, there is no molecular death. So molecular death means cellular death. Death occurs at the cellular level. That is classically seen in case of rigor mortis, that is absent in case of cadaveric spasm. So this is also very important. So all of you write in the chat box. In cadaveric spasm, no molecular death. And I said, so when there is a molecular death, it does not respond to stimuli. So this does not respond to stimuli. Medico-legal importance, it is very helpful in estimation of time since death, and cadaveric spasm is very helpful in estimation of manner of death. So manner of death. So this is what you need to write in the exam. Good. Good, Smaranya. So then a few questions from autopsy. So very commonly asked 3 marks question. Mention the types of skin incision during autopsy. Can anyone answer? Autopsy. See, autopsy is also known as post-mortem examination. It is also known as thanatopsy. Thanatopsy. Necropsy. Post-mortem examination. So it can be an MCQ. Okay. So autopsy can be of different types. So what are different types of autopsy? So one very common autopsy that is in forensic medicine department. So that is basically medico-legal autopsy. Medico-legal autopsy. So very common, usually conducted by the forensic expert. The second one is clinical autopsy. So clinical autopsy conducted by pathologist to find out the pathogenesis. The consent is very important in clinical autopsy. The consent is not required in medico-legal autopsy. Very important. Then any other type? Any other type, guys? Other than this, any other type? So I said medico-legal autopsy. That is in case of firearm injury, road traffic accident, homicide, suicide and all. My question, other than these two, any other type of autopsy? Okay, SJ, Arlene. Ha, very good. So there is one more type that is known as psychological autopsy. Psychological autopsy. That is basically questionnaire to find out the mental status of the person, especially in case of suicidal death, to find out whether there is a depression and some other associated condition. Psychological. And autopsy can be done with the help of MRI and CT scan. That is known as virtual autopsy, also known as autopsy. Autopsy. So there are basically 4 important types. Okay, good. Then comes is 2 more important questions commonly asked. So what is negative autopsy? and obscure autopsy. Obscure autopsy. Okay. Commonly asked. Negative autopsy means negative. Negative, negative, negative. Forensic examination negative. Lab examination negative. Histopathology negative. Everywhere negative. No findings at all. No positive findings. Okay. So negative autopsy means negative. Only negative findings. No, no, no. So that is post-mortem examination negative, histopathology negative, FSL negative, everything negative. So can you give an example for negative autopsy? Let's see who is going to answer. Negative autopsy, no findings at all. But in obscure autopsy, there are some minimal findings. Minimal positive findings. There will be some minimal finding, but that is not suggestive of any cause of death. Okay. Yes, good. Negative autopsy means, okay, Arlen is answering and SJ is also answering, Universe is answering. So negative autopsy, one example is vasovagal inhibition. Vasovagal inhibition. Or in case of common crate bite. Okay, common crate bite also can be an example. Or in case of death due to status epilepticus. Death due to status asthmaticus. So you can write 3 causes in exam. One common cause is vasovagal inhibition. Okay. So status epilepticus, and status asthmaticus. So all these are negative. In obscure, it is like a negative autopsy only. There are some minimal positive findings will be there, but that is not suggestive of any cause of death. Okay. Now come back to the question. What are the types of skin incision? Yes. So all these are 5 types of incision. So let's make it interactive, guys. You need to identify what are these incision. Identify all the 5. So this is very simple question. A, B, C, D, E. You take your time, take around 20-second time and try to identify. Okay. So in first type, what we can see here, the incision from pubis into pubic symphysis, and basically chin to pubic symphysis. So this is known as eye-shaped incision. And it is most common. So eye is most common. You can remember eye means important. Important, that is most common. Starting from chin to pubic symphysis. Sparing umbilicus, because umbilicus is made up of fibrous tissue. So it's very difficult to do resuturing after the examination. So this is eye. And the second one, so what you can see here, second one, in this acromion. So from the acromion, the undersurface of the breast, and to the midline. So this is known as Y-shaped incision. Again, there is a lot of confusion. So this is what given in case and Reddy. So it is given ulta in some other book, but you can write the same example. So why we can start with the acromion, undersurface of breast, and to the midline to the pubic symphysis. So it has cosmetic importance. Especially in females. So like, incision over the chest, so over the mammary gland doesn't look good. So that's why this is used, Y-shaped incision. Then comes is your modified Y. So this is modified Y. So modified Y, that starts with the mastered process and to the midpoint of clavicle, from the midpoint of clavicle into the sternal joint. Okay, so this is commonly done in case of hanging, strangulation. So then this one, that is subclavicular approach. So this is known as T-shaped incision. T-shaped, subclavicular. So this incision commonly done to visualize carotid arteries and the some related pathology. And this is X-shaped incision. X-shaped incision. So X-shaped incision commonly done on the back, again from the acromion process around the your scapula and to the midline. It is normally done to rule out any spinal cord injury in case of custodial death. Then there is one more type, inverted Y. Can anyone tell me where inverted Y we normally use? Inverted Y. जल्दी बताओ इन्वर्टेड वाई. सो कहाँ यूज करते हैं इन्वर्टेड वाई? इन्वर्टेड वाई, कम ऑन गाइस, इन्वर्टेड वाई. Yes, very good. Inverted Y normally done in case of infant death. In case of infant death, or in case of stillbirth, or dead birth, or live birth. So in that case, to roll out the level of diaphragm, we are going to open the abdomen first before the thoracic cavity. So that is known as inverted Y incision. So I'll repeat again, there are 6 incision, guys. So one is I, Y, modified Y, T-shaped incision, X-shaped incision, and we have inverted Y as well in case of infants of fetal death. Okay. So write this all of you in the chat box, guys. Types of skin incision is equal to 6 types. Write this 6 types so that you can memorize. There are 6 types of incision. You can write all the 6 types in exam. So keep writing this. Okay. So the next comes is again the 3 marks question. What are the techniques of autopsy? What are the techniques of autopsy? Also known as techniques of evisceration. So techniques of evisceration, basically there are 4 types. One is Letule, Virchow, Gone technique, and Rokitansky technique. So a bit difficult, all of you. So try to understand Letule, Virchow, and Gone and Rokitansky. So what is Letule? I'm going to write here Letule. See, Letule is the best technique because we are going to do en masse dissection. So we are going to remove all the organs, en masse dissection. So we call it as en masse. That is from tongue to prostate. So in Letule technique, from tongue into the, that is basically prostate, all the organs are removed at a stretch. One of the difficult technique to do. en masse dissection. Remove all the organs en masse. That is Letourley. Letourley is the best technique. So all of you write in the chat box. Letourley is best. The second type, that is known as Gaunt technique. So in Gaunt technique, which is a modified technique of Letourley, we are going to do organ block. We are going to do organ blocks. So instead of removing all the organs, basically from tongue to prostate, we are going to divide into three. One is cervicothoracic. The second one, abdominal. And the third one is pelvic. So we're going to do three blocks like this. One block, second block, and third block. One block, second block, and third block. So remove from tongue to all the lungs, everything, heart, everything in one block. Then all the abdominal organs in second blocks. Then pelvic organ, prostate, all this in the third block. Like this. 1, 2, 3. 1, 2, 3. Getting my point, guys? Menaka and others. So whenever I do like this, what is the technique, guys? 1, 2, 3. What is that? Get 1, 2, 3. 1, 2, 3. Great. So great mnemonic. 1, 2, 3. That is basically gone. Then comes is your very common technique, Virchow technique. So Virchow means 1 by 1. 1 by 1. That means you are going to remove the organs 1 by 1. Like example, opening thoracic cavity, removing heart, then removing lungs, then removing other organs 1 by 1. Aram se just open the midline incision, then take out the heart, examine heart, okay, lungs examine, okay, then like that. So 1 by 1 technique is basically known as Virchow technique. It's the most common technique. Most common technique. Now say some example. Say example, dead body is COVID-19 positive, or HIV positive, or hepatitis B positive. What is the technique we are going to use? 1 by 1. Come on, guys. 1 by 1. What is the technique? If you open the organs, Gaunt technique, Letourley, or Virchow technique, definitely there will be a risk of transmission of HIV and hepatitis B to the doctor or to the technical staff. So in that case, we are just opening the midline and we are doing in situ dissection. Just opening an in situ dissection like this. So that is known as Rokitansky. So Rokitansky matlab organ dissection in situ. So that is Rokitansky. I hope you are understanding. Aishwarya and others. So I'll repeat again. From tongue to prostate, that is basically known as Letourley. 1, 2, 3. That is known as Gaunt technique. 1 by 1. 1 by 1. That is known as Virchow technique. Common technique. In situ dissection known as Rokitansky technique. I hope you understood. Hai na? Vasishta? Okay, that's great. So next comes is about the preservation of viscera. Again, 5 marks question commonly asked. Write about components of routine preservation of viscera. So what are the viscera? They are preserved. As you know, very simple question. Stomach and stomach contents, upper part of small intestine, liver along with the gallbladder, kidney, half of each kidney. So blood around 10 ml or 30 ml, urine around 100 ml. So there are basically 5-6 viscera you need to preserve. So like this, we are going to prepare bottles. Okay, so bottle number 1, bottle number 2, bottle number 3, and bottle number 4, and bottle number 5. Okay, This 1, 2, 3, 4 and 5. So in 1, so basically we preserve stomach and duodenum, stomach and duodenum. In bottle number 2, liver. So along with the gallbladder, along with the kidney. So here basically blood and here basically urine. So my question is, what is this bottle? What is this bottle? देख के बताओ ये क्या हो सकता है? Bottle number 1, stomach and duodenum in NaCl, saturated solution of NaCl. Bottle number 2, liver, gallbladder and spleen or whatever, spleen, kidney, whatever that is. And 4, that is blood, we use sodium fluoride. Urine, we use thymol as a preservative. My question, what is bottle number 3? Or we call it a bottle number 5 also in books. What is that? Bottle number 5. So bottle number 5, basically preservative. Preservative sample. So as you know, preservative can be NaCl, it can be rectified spirit. So in any case of viscera preservation, we need to preserve some amount of preservative also as a control, basically as a control. So that is actually bottle number 3, or some books use bottle number 5. That is also correct. Okay. So saturated solution of common salt. Okay. Now let's see some more points here. In some condition, you need to preserve bones. What is that condition in which bones are preserved? Especially stomach, especially the femur is preserved. Femur. Can anyone tell me? Oh, Smaranya, best specimen is rectified spirit, not the saturated solution of NaCl. The best is rectified spirit. Again, there are indication, contraindications and all that we discussed in regular classes. We can just go through that. So my question is, the bone is preserved in some condition. What is that condition where bone is preserved? Very good, especially in case of diatoms. Good. In case of diatoms. Arsenic. Heavy metal poison. Bone is preserved. In some condition, heart is preserved. Heart. In case of aconite poison. Cardiac poison. In any cardiac poison, heart is preserved. Spinal cord. In case of strychnine poison. Strychnine poison. Renal fat is preserved in case of insecticide poison. Okay. Then in some condition, you need to preserve skin also. In case of firearm injury. Firearm injury. Or in case of injection mark is there. Injection mark. So in that case, skin also must be preserved. Hope you are getting my point. Scorpion bite and all, okay, firearm injury. So that's great. You can write all this in exam. So normally the blood is collected from the femoral vein and the preservative is oxalate, that is EDTA and oxalate. So you can use oxalate. Urine, that we use thymol. Firearm injury and all, that's great. Okay. Then other important questions after the class, you just go through these important questions. Very, very important topics, commonly asked as a 5 marks question and 3 marks question. The first important one is the putrefaction, a 5 marks question. So we need to write about the definition of putrefaction. What is external putrefaction? What is internal putrefaction? and also you can write about the Casper's dictum, very important. Then comes is Livor Mortis. Definition of Livor Mortis. Then comes is what is normal color. Then what is the medico-legal importance of Livor Mortis? The color change in different poisoning. You need to write. Algor Mortis, again 5 marks question. Especially the curve of Algor Mortis. Inverted S-shaped curve, commonly asked. Eye changes, 3 marks question. Types of autopsy, we discussed already, 3 marks. Exhumation, 3 mark. Time since death with various method, it can be 10 mark. So it's given in Farre book, you can just go through that. Time since death with various method, with help of rigor mortis, livor mortis, with help of other changes in the body. Okay, so that is time since death. Embalming can be a 3 marks question. Mummification can be a 3 marks question. Adipocere, 3 marks question. So all these are important question from Thanatology. Okay, now let's discuss some important images. So we call it as forensic spotters. Yes guys, are you ready for the forensic spotters? Thanatopraxia, very good. Chalo, forensic spotters, some images related to autopsy. Yes guys, shall we start forensic spotters? Are you there? My dear student, how is the Josh? How is the Josh, my dear students? Josh should be very high all the time in all the classes, forensic classes. Maranya Hati, okay. Maneka Datta ready, SJ ready, Srinivas ready, Vasista ready, okay, Arlen ready, Maneka Datta, Aishwarya, okay, hi sir, okay, great. Chalo, let's start. So the first question. Now, this can be a spotter in your exam. This is basically mummification. Now my question is 5 points about mummification. 5 important points that is visible on this image. Can you answer in the chat box? I said mummification is a modified form of putrefaction. It occurs in hot, dry environment, right? Yes. So the first question, mummification. Five points. That is visible on this image. Take your own time and try to answer. So the first point, as I think Srinivas answered correctly, yes, Srinivas. So this is the late postmortem change. Point number 1. So what you can see here, the facial features are very well preserved. Okay, facial features are very well preserved. You can make out injuries, you can make out cause of death, sometime manner of death, and related things basically. So then it occurs in hot and dry environment. With air movement, with absence of moisture. Then it occurs in 6 months to 1 year. 6 months to 1 year. Then in case of mummification, the color of dead body is brown or black. So 5 points you need to write in the exam. I'll repeat again. Late postmortem change, Facial features are very well preserved. Hot and dry environment with the air movement. 6 months to 1 year. It varies from country to country, but it occurs in basically in high temperature areas. Brown or black color. There is a loss of body weight up to 70%. Okay, all these are basically important findings. Good. So Arlene, okay. Arlene, very good. Also, Arlene answered. Aishwarya answered. Srinivas also answered. That's great. So good. So many answered. Now look at the face now. This mummification. So what you can see here, the face appearance now, laughing mummy. So very interesting case. So this is known as a laughing mummy. Okay guys, is it interesting? We can make out here, this is probably a dead body of 3 or 400-year-old and the facial features somewhat laughing. Laughing mummy. Yes guys, laughing mummy, keep writing. Good, good. Fine. So this is about the first question. So the first to answer, I think Srinivas and others. Great. Second question. So all of you concentrate on the question. In second question, what you can see here, right eye and left eye. In the right eye, there is constricted pupil. Left eye, dilated pupil. So dilation is because of atropine. Atropine. So my question is, what is the concept in this image? What is the concept in this image? So this is the eye examination 1 hour after death. Atropine is instilled on the left eye. You can see here dilation of the pupil. And there is a mydriasis that is in the dead body after death. But on the right side, there is no mydriasis. There is basically a dilation or mid-dilated pupil, or we call it as constricted pupil. So my question is, what is the importance of this image in relation with thanatology? Okay. Come on guys, try to answer. Can make out here. Let's see. Okay. No, it is not hippus. No, Dr. Sinch, it is not hippus. Suspend animation, no. Depth showing, no. Fixation of pupil, no. So this is basically to explain you, there is no onset of cellular death here. Okay, so this is basically somatic death. Somatic death. In somatic death, the muscle can respond to some stimuli, electrical stimuli, mechanical stimuli, or some eye muscles, sphincter pupillae or a dilator pupillae, they respond to physostigmine or atropine. So this just to explain about cellular death. Cellular death. So my question guys, what is the stage in this dead body that is showing some response to the atropine, that is usually up to 1 to 2 hours? Is it somatic death or cellular death? That's what I'm going to ask you. Come on guys. So this is classical case of somatic death, not a cellular death. The cellular death occurs slowly. Once there is a cellular death, the muscle will not respond to any stimuli. So somatic death, that's all. Okay, very good. Srinivas is also telling, sir, this property is used to, also for the organ transplantation. Yeah. So cornea can be removed up to 6 hours. Good. So not immediately after death. So usually up to 6 hours, in some center up to 24 hours. Why? Because there is no onset of the cellular death up to 24 hours. Okay, so this is what the funda. This is given in standard textbook, Anil Agrawal textbook. Okay, good. Now look at this. Now you are in Shava Pariksha room. Now I am in Shava Pariksha room, autopsy room. So one of my junior, one of my a PG is doing dissection of the liver. So this is basically liver, and the liver is not looking normal. So my PG is telling, sir, normal liver, but I am telling it is not normal liver. It is something else. There must be some poison. By looking at the liver, by looking at the color of the dead body, looking at the postmortem staining, again suspect some poisoning here. What is this? What is this method? What is this known as? So this is not normal color. So this is cherry red color. Cherry red everywhere. The postmortem staining is cherry red, and the most of the organs are showing cherry red discoloration. What is your diagnosis in this case? Very good. So this must be carbon monoxide poisoning. Carbon monoxide poisoning. So now, yes, good. Dr. Sinch and others, good. Now, very important question, the color of postmortem staining. Color of postmortem staining. So there are 5 important colors. So one is purple color. So purple is normal. So my question is brown color, black color, pink color, yellow color. Can anyone answer? What is the different color? Or what are the poisons showing brown color? Then black color, pink color, pink. Then yellow color, yellow, dirty fellow. Try. So brown color that occurs in, yes, good. Smaranya, very good. Smaranya answered correctly. Smaranya is telling, sir, brown color occurs in yellow phosphorus. Black color occurs in opium poison. Pink color occurs in case of cyanide poison, or we call it as hypothermia as well. So pink basically hypothermia. Hypothermia. So yellow color, it occurs in yellow phosphorus. Yellow phosphorus. Yellow, dirty fellow. That is yellow phosphorus. It leads to acute liver atrophy, liver failure. When liver failure is there, there can be jaundice. So liver, jaundice, yellow color, yellow phosphorus. Good. So I think purple, okay. मैंने कहा था good. Purple होता है normal में, brown phosphorus में, black होता है opiates में, ठीक है, pink cyanide में, और yellow होता है yellow phosphorus. मैंने कहा very good. The first answer is by Menaka Datta. So Menak Datta, very good. Good. Now fourth one. So before that, very important table from standard textbook. So there are 9 different colors. Commonly asked 3 marks, 5 marks question. So black mummified body opiates, bluish green hydrogen sulfide, bluish violet asphyxia, pink color hypothermia, bright red hydrogen cyanide, bronze septic abortion, cherry red carbon monoxide, chocolate color in case of nitrates, dark brown yellow, yellow phosphorus. Very, very important table. So all of you write in the chat box, dairy milk color, dairy milk color. है ना, dairy milk आपको पता होगा. So the answer is basically nitrates. Write this, dairy milk is equal to nitrates. Okay. Chal, next. Now I am in the Shava Pariksha room. So during autopsy examination, what I found, this image, what we can see here, tree-like pattern, tree-like pigmentation of yellow and black, green color, red color, like this, you know, like this, like this, like this. So commonly occurs in the upper part of the thorax, sometime trunk, sometime upper limb and a lower limb, or sometime over the neck. So this is a case of hanging, okay. So this is a case of hanging. So what you can see here is the ligature mark, but during examination, so what is this finding known as, and when this going to appear? So two questions, identified and time since death. So two questions only. So write the question number and try to answer. So this is known as marbling. It occurs in 24 to 36 hours. And this appearance known as road map appearance, greenish road map appearance. So this is because of self-met hemoglobin that is produced by Clostridium welchi. So this is showing putrefaction. Greenish road map appearance. Good. The first to answer by Aishwarya and Dr. Sinch. So Dr. Sinch, very good. Now one more question. Now I am in the autopsy room, Shava Pariksha room. Now what we can see here at the bony prominences, so there is an abrasion is there. So there is an abrasion, but there is no inflammation. There is no inflammation. So my question is it antemortem abrasion or is it post-mortem artifact? Srinivas and others. So in dead body examination, at the wrist, at the elbow, at the knee joint, there are some abrasions are there. There are some skin slippage is there, but there is no red line of inflammation, no signs of blisters and all. Just a finding, just a abrasion. but it mimics like antemortem finding. So what is this known as? So good answer. So this is Manjunatha again and Erlin also. This is postmortem artifact. Postmortem artifact. So the question can be asked, how to differentiate between antemortem aberration and postmortem aberration. So antemortem aberration occur anywhere. Signs of inflammation present. Postmortem artifact aberration that occurs in the bony prominences, usually at the limbs, and there are no signs of inflammation, no blisters, nothing. So this is postmortem artifact. Now one more important image taken from standard textbook. This is the case of putrefaction and this is liver. So the liver in putrefaction, showing gas bubbles. So what we can see here, so liver, as you know, liver is the largest organ. The weight is around 1.5 kg. When you open the liver, at the cut section of the liver, there are some gas bubbles are there. What is this appearance in advanced putrefaction or putrefaction known as? So very simple image based question. Yes, good. So this is slicing of the liver. Okay. Dr. Sinch, okay. Srinivas, foamy liver. Okay. So good answer. So from Srinivas, good answer. Srinivas, great answer. So this is known as honeycomb liver. Honeycomb liver, also known as Swiss cheese appearance, commonly asked. Okay, good. Then question number 7, a very important question. So now I am in autopsy room, that is booth bungalow room. So you know autopsy in Delhi, when I was working in MAMC, New Delhi, Maulana Azad Medical College, we used to do around 10 to 20 autopsies every day. So autopsy room is like a booth bungalow room. You will get a lot of dead bodies there. So you will get a lot of finding. Every case is challenging. And in this case, what I found some maggots over the dead body. So maggots means they are larvae of the fly. So very foul smelling dead body. My question, what is the importance of maggots in forensic medicine? Okay, maggots. So what is the importance of that? Two importance. You can see here maggots. The white color larvae of the fly. We call it as blue bottle fly, green bottle fly, Musca domestica and all. So what happens actually, dead body, no? Dead body will attract the flies. The flies comes and they lay eggs. The eggs becomes larvae. Larvae become pupae. Pupae become flies. So my question is, what is the importance of this larvae? Good answer. Yes, many students answered, sir, this is very important finding of time since death. Excellent answer. So this is very important for time since. So when you see maggots, it's around 3 to 4 days. So when you see adult flies, around 10 to 12 days. So when you see adult flies, 10 to 12 days. Important MCQ. When maggots are there over the dead body, time since death is 3 to 4 days. When adult flies are there over the dead body, then it is 10 to 12 days. So what are the stages of fly? Egg, larvae, pupa and adult stage. 3 marks question. Study of this known as forensic entomology. What are the common flies? House fly, Musca domestica, green bottle fly, blue bottle fly. So the importance is time since death. So one more thing. Any other than this? The importance of this, I think, any other importance other than this? So one more importance is, in some cases, you can detect some poisons in maggots also. Okay, you can detect the poison. So you can detect some poisoning. In some crime scene, you will get only maggots along with some body parts. In that case, you can study the maggots and larvae to detect the poison, cyanide poison or some other poisons. Then maggots also very useful to find out the place of crime. Place of crime. So three important. Importance of maggots. The point number 1, times is death. Point number 2, poison. Point number 3, place of crime. Okay. Is it interesting, guys? Is it interesting? Study of forensic entomology. Okay. And you can keep this maggots in formalin or in alcohol, rectified spirit, and you can examine later. Okay, Vasista and all, that's great. Maneka Datta, good. Smaranya, why honeycomb liver? Good. So good question from Smaranya. So honeycomb liver is because of the gas formation within the liver. So gas gangrene or the Clostridium welchi when it causes putrefaction. So there can be like gas bubble like appearance. So probably because of putrefactive changes, because of the proteolysis, because of the decomposition change in the liver. That's all. Okay, good. Now look at this now. This is retina. Retina of the dead body that is seen within 10 minutes after death up to 1 hour, which can be detected by ophthalmoscope. This is known as some sign. What is this sign known as? Can anyone answer this? Yes, my good. So okay, first to answer by Aishwarya Baligar and SJ. So Aishwarya, very good answer. So she said, sir, this is my cattle trucking sign. Cattle trucking sign. Some books use shunt sign. Some book says Kevorkian sign. So three types of, there are three names are given: cattle trucking, shunt sign, and Kevorkian sign. So this is fragmentation of blood in the blood vessel. It can be seen in any blood vessel, but it is noticed in retina blood vessel. Good. Railroad sign, good. So also known as railroad sign. Seen within 10 minutes, persist for about 1 hour. The first discovered by Dr. Kevorkian, Dr. Death. So yes, less practical value. Nowadays it has no practical value. That's okay. Then the question number 9. This is very important question. Again, this is very challenging, I'm telling you. All of you concentrate. So what you can see here, this is postmortem staining. And this is contact flattening. Okay. This is a case of road traffic accident. A 40-year-old male died due to steering wheel injury. So steering wheel injury, like this steering wheel injury, and this was the position in which dead body was kept, like this it is. It was basically a driver. My question is, what is this finding known as, and what is this actually basically this? Come on guys, try to answer. What is the medico-legal importance of this? Post-mortem staining, what is the medico-legal importance? So there are some 2-3 points related to this case. Post-mortem staining seen over the front of the body. Post-mortem staining is not there in some areas, which is known as contact pallor, and this is fixed. This is fixed. My question, what is your inference by looking at post-mortem staining? So the point number 1, it shows that the body was kept in the prone position, right? Prone position. Any other finding? Any other finding? Carbon monoxide? No. Yes, carbon monoxide, cherry red color, okay, but it's not exactly cherry red. It looks normal, purplish reddish color, normal color. Prone position. And Smaranya Hatti is telling, sir, it is fixed. That means it is more than 6 hours. More than 6 hours. Great answer. Smaranya, great. Now what you can see here, there is a contact pallor here. Look at this now. You just let me know. It is extending from left to right, like this. Left to right, or sometimes it's from right to left also. So is the front seat passenger or the driver? Yes, very good. Srinivas got the answer. Sir, this is seat belt injury or seat belt marking. Seat belt. Great answer. My question now, it is extending from left here and to the right. What you can see here, the appearance like this. And like this it is. Left to right. So my question, is he front seat passenger or the driver? Come on guys, come on. Try to answer. Try to answer guys. Very good. So he is basically front seat passenger. Front seat passenger. And one more important, the color. So the color is sometimes cherry red color. Cherry red, maybe due to carbon monoxide. As you know, in road traffic accident, there will be sudden closure of the windows. There will be, fumes and all everywhere. So that can lead to carbon monoxide poisoning and death. So yes, that's great. So no steering, okay, very good. No steering wheel mark, that is also there. So this is how you can solve the case. I'll repeat again. So here post-mortem staining seen at the front of the body, that means prone position. It is fixed because there is no color change more than 6 hours. Contact failure because of seat belt from left to right, front seat passenger. Color is cherry red color, carbon monoxide poison. See, one image can give you so many clues, है ना? लाश एक मूक गवाह है, वो कभी झूठ नहीं बोलती. Dead body is a silent witness that never lie. Do you agree with me? Dead body is a silent witness that never lies. लाश, डेड बॉडी एक मूक गवाह है, वो कभी झूठ नहीं बोलती, है ना? That never lies. Agree with me guys? Srinivas and others. Now the last question. Now the last question. Now look at this now, and you estimate time since death. Estimate time since death. TSD. Just time since death. So again, this is the case of unnatural death. So we are in the postmortem room. So what we can see here. So here the hand of the examiner. Okay. And you can see the leg. The leg, the soleus muscle, all the hamstrings, all the muscles of the leg showing very strong rigor mortis, involving fingers and toes as well. What is the time since death? Look at this image, and one more image. Look at this. Eyelids, that is showing rigor mortis. Look at the jaw, also showing rigor mortis. Neck also showing rigor mortis. Neck muscle also showing rigor mortis. Fingers and toes, rigor mortis present. My question is, what is time since death? So here time since death is more than 12 hours. So more than 12 hours. That means it developed in all the voluntary, involuntary muscle more than 12 hours. So usually 12 to 36 hours. So as per Nysten rule, if you know this, more than sufficient for an UG student or PG student, they can learn some more deeper concept. Okay, more than 12 hours. Okay, so this is about the images. Now the last session is about the doubts. If you have a doubt, you can ask me now for next 5 minutes. Yes, Maranya, are you there? Vasista? Yes, good. Many answered. Aishwarya, first to answer. And second phase, Maranya Hatti. Okay, that's great. So last 10 minutes, guys. If you have any, how to detect? So how to detect TST from rigor mortis? Okay. Okay, Srinivas answered first. Okay, that's great. Sir, Casper's dictum. A pink teeth. Good. So the first question is from Casper's dictum. The second question, pink teeth. Pink teeth. Okay. So rigor mortis already answered, Smaranya. So it is all depends on the joint that is involved. So again, there is one more classification given in standard textbook. So the appearance and disappearance. So that we will discuss in next class. So there is a table is there. I'll show you that table and teach you in next class. Okay, if you want in depth. Okay, Magnus test. So Magnus test and all outdated test. So nowadays, now we are 5G world. So all is Magnus test and all outdated test. So they are not asking this type of question nowadays. Magnus test, Winslow test and all. Okay. Casper dictum means rate of decomposition. Yes. So rate of decomposition. So in air, water and earth. So Casper dictum is the rule of rate of decomposition in different media, air, water and earth. In air it will take 1 day. For example, 1 day in air, it will take 2 days. in water, it will take 8 days in earth, or in case of buried body. You can remember like this: AWE, AWE, awesome, awesome 128. So mnemonic, awesome 128, Casper dictum. You can write this in chat box. Awesome 128. Keep writing, awesome 128. So pink teeth commonly occurs in decomposition. So this is because of hemoglobin. So hemoglobin lysis in dental tubules. In dental tubules. So it is not the common finding. It's seen in some condition, pink teeth. So pinkish appearance at the base of the teeth known as pink teeth. Okay, so keep writing this. Zacco phenomena, very good. Zacco phenomena. Zacco phenomena, asked in NEET PG exam recently. I said already, so after death, no, there will be somatic death, then cellular death, then there will be decomposition and all. So Zacco phenomena is mechanical excitability of the muscle. Mechanical excitability of the muscle, especially hamstring muscle, are the muscles of the. So in simple word, it is the mechanical excitability. Of muscle during somatic death. So during somatic death or during supravital period, the muscle respond to mechanical stimulus. So that is known as Zacco phenomena. Usually the muscles of the leg, muscles of the, so that is thigh, we normally, okay. Zacco phenomena 128, that's okay, that's great. Then why normally lacerate wound bleeds less but scalp ulceration bleeds profusely? Okay. Yeah, why? Because you know the vessels, basically the facial vein and all. So facial vein, they are superficial in nature. So the laceration at the other side, like for example, thigh and other side, so veins and arteries are deeper in nature. So, but in scalp, they are superficial. And also one more point is, so you know, skull is a hard surface. So the laceration caused by the hard surface blunt object. So that leads to, you know, profuse bleeding, especially over the scalp. So that is the reason. Post-mortem caloricity. Okay, some question from post-mortem caloricity. So post-mortem caloricity is increase in body temperature after death up to 1 to 2 hours. Okay, increase in body temperature up to 1 to 2 hours. So normally what happens, body temperature decreases, that we call it as Algor Mortis, but here body temperature sustained or it increases. What are the conditions? So one is, so 4 conditions you need to mention. One is sepsis, gram-negative bacteria, so can lead to post-mortem caloricity. Pontine hemorrhage, violent death, like example tetanus, strychnine poison, sunstroke, heat stroke and all, example for post-mortem caloricity. I hope this Srinivas you understood. Vasista, understood now? Acha, drowning index. This we will discuss in some other class. So drowning index DI, and one more, that is Rigor Mortis question. Rigor Mortis. Can just write this in comment section, so that in next class I'm going to cover that. So both these questions after the class, not in the live. So once class is over, you can just type your doubts. So next class I'll come back with the better answer and images. Okay. So this okay, then any other question, guys? Smaranya. See, medical maloccurrence is a good defense. Like example, because medical maloccurrence something unexpected in general. So unexpected presence of some injuries, anaphylaxis and all, definitely defense in any case of medical negligence. So this completes your yes, Srinivas, Manika Datta, Arlin, Aishwarya Baligar, SJ, Smaranya Hatti. So you can write your questions in the comment section in YouTube. So in next class, also your feedback. So I hope you enjoyed today's class, especially all these images and all. So today we started with some main questions today. I think this was the first question we started. I hope you've understood everything in short time, around 2-hour class. Srinivas and others. Acha, Bolam test. Okay, Bolam test is also a good question. So Bolam test, Bolito test. So we will have discussion in next class. So both are the test of medical negligence. Bolam was the patient. So Bolam versus free in hospital. So we'll have discussion in next class. Okay, good. So this is about the today's session. So thank you all guys. We have two more sessions of forensic medicine, Farre. Next session is toxicology 1 and last session toxicology 2, and in between we'll have discussion about X-rays. X-rays are missing, X-rays we are going to discuss, and some spotters and some important doubts in forensic medicine. So I hope you are enjoying class and getting some interest in forensic medicine. Forensic medicine is very scoring subject, very interesting subject. So if you learn with the images, videos and all, so it will be very helpful. Yes. But a short note on judicial magistrate. Okay, Smaranda is asking one more question, sir. Short note. Judicial magistrate. So JM, judicial magistrate. So you can start with the first class, second class. We can tell about the power of first class magistrate and also CJM court. CJM. So basically magistrate court. So session courts, they're basically district court. So magistrate court are classified into first class magistrate, second class magistrate and the CJM court. So the power of CJM is 7 years and unlimited fine. Second class magistrate 1 year and 5K. And the first class magistrate 3 years and 10K. So this you can write for 3 marks question, that is more than sufficient. Smaranya, okay. Yes, any other doubt, Maranya?